Hi everyone, I'm Yuji, and welcome to today's briefing of on epidemic in the UK. Today, I want to share the urgent problems faced by COVID-19 and my proposal to solve the problem. Since the outbreak of COVID-19, we have faced unprecedented healthcare pressure. Meantime, our people have suffered various challenges. The problems of unemployment, social disorder, food, and other necessities shortage have greatly influenced normal social order and are waiting for us to solve. Today, I want to focus on the group of the poverty. Before the pandemic, about 14.5 million people were in poverty in this country. During the pandemic, another more 700,000 people faced the financial crisis. The poverty figure rises up to 15 million now. This is a large group, obviously. The problems relating to them cannot be ignored. There's a virus data prove that the poor is one of the weakest groups hit by the pandemic, and they are more likely to be infected, and they are the groups that are groups we need to support. We need to provide more support. Okay, COVID is at risk of becoming a disease of the poor. Adam Rock is a poor and ethnic diverse in the city suburb of Birmingham. The infection rate is high in this area, around 255 per 100,000 people are infected, but the rate of vaccination is low still. Only 6 in 10 of the old age over 80 has been vaccinated. A few miles to the north of Alum Rock is as Sutton Four Oaks. It is a rage area with detached houses and the three-line street. The inflection rate is much lower. About 88 per 100,000 people are infected, and the influence rates have been reduced 3 times recently even. But nearly 95% of the old age over 80 has been vaccinated. The situation is not unique in Adam Rock and Sutton Full Oaks. It is a pattern repeated across the country. The poorer people are more likely to get infected, but less likely to have been vaccinated. Not just vaccine, the infection and the death rates are higher in deprived and ethnic diverse communities. Office for National Statistics shows that the people who live in the most deprived communities are more than twice as likely to die from COVID as those in the least deprived. Among the most deprived people, the death rate is 300 per 100,000, while among the least deprived people, the death rate is 120 per 100,000. The inflation rate is also higher in the poorest communities. Our government's surveillance program REACT showed that the infection rate was 50% higher in the most deprived area than the least deprived area in the peak time. In the pandemic, inequality has been more exposed. So here comes to a problem. Why? Why the why the poor is more fragile in COVID-19? I summarize several reasons. First, the poor are paid low and have less secure in workplace. Most of these people are paid in low with insecure contracts. They are most likely to lose their jobs after the block, and the majority of them work in precarious or manual jobs in carrying retail or service sectors. They earn little and they basically have no savings. Once they do not go out to work, they will have no income to afford a daily expenditure. Therefore, even in the peak time of the pandemic, they still chose to work if possible. In addition, their jobs have to be done face to face. Mostly, they can't work from home. Some of the workers have to work in crowded factories or shops. This increases the risk of being infected. Second, overcrowded and poor quality housing is another reason. Most of their communities are densely population. If one person has some symptoms or even is infected, they don't have enough space to isolate at home. and the poor healthcare services in their communities prevented them from careful checking. Third, the poor has worse health condition before the pandemic than the rich. When the pandemic breaks out, they become more vulnerable. The pre-existing illness worsens their health once they infect the virus. Analyzed by the Health Foundation have has shown that before the pandemic, people in the poorest tenth of the country were 3 times more likely to die particularly than some in the richest tenth. The emergencies of COVID was likely to increase the gap even further. The health gap intensities the wealth gap. High rate of cases, high proportion of unemployment among the poor, and they have to spend more money on their healthcare because of their bad situations from the past. The communities will be blocked even longer. The further as their disadvantages. So the problems of the poor in the pandemic is not temporal. It is in intention the poverty and social inequality. These people can't solve the problems by themselves. They need support from the government, and we have responsibility to help them. I propose three policies to help solve the problem. The first, the policy is to increase the poorest income. This is the most important and effective way to reduce poverty. Due to the pandemic, lots of companies closed and employees lost their jobs. Government needs to take actions to maintaining current jobs and create more jobs. The solution is to subsidize private sectors and to hire unemployed and low-income workers and efficient methods and short term. U.S. has implemented this action in the pandemic and in the Great Recession in 2008. The subsidies will cover the cost of hiring and the salary. It will be fully paid to private sectors by government in the first 3 months, and half substance will be paid in next 3 months. The employers have to guarantee to hire the employees at least another 3 months without subsidies. This approach not only guarantees the income of lower paid workers, but also benefits the employers who are struggling in the crisis. The similar approach was implemented in the Great Recession in the U.S. in 2008. Okay, and it contributed to helping U.S. government come over the recession. The second approach I'm going to talk about is to provide direct support to poor family. The support will include a necessary training program and education to improve the adults' work skills and abilities, which benefit them to find a better job and increase their income. It will also include qualified healthcare to reduce their infection and the death rate, and enhance their health and condition. It will also provide a critical nutrition assistance to the families who need it the most. The direct support also extends tax cuts for poor families. The taxes on wealthy families should increase, while the tax on the lower income families should be reduced. The government is suggested to issue particular tax acts for the poor people, give them favorable support on taxes. Biden's government announced a similar plan to help the lower and middle class in the U.S. It is called the American Families Plan. Based on the leading economic research, the investment on families will produce significant economic returns. It will improve productivity and economic growth by protecting a large, more productive and healthier workplace. continuously, it will save the national cost in the long term. The third approach I'd like to propose is the program of cash transfer to poor families. It is one of the most effective and efficient method to reduce poverty in the short term. And the program, a certain amount of cash will be provided to the poor family, and the poor family can give money assistance to help them to get through the difficulty. Most importantly, the value of money is expanded in the transfer. The consumption and economy will be boosted by the poor. They will spend more on buying things like food, clothes, or to rent, or maintaining all the necessities. This will boost the the other economy industries and create more jobs, helping reduce poverty. The program has been proved successfully in reducing poverty in many areas, including USA. The property rates reduced over 10% after the cash transfer program. Although the three approaches are feasible, I think the minister should pursue the first approach. The second approach is a long-term program. It can't produce the most obvious effective effect in a short term, while the poor people in difficulty need assistance immediately, which is which doesn't match. For the cash transfer program, it is the most effective way to help the poor to go through the crisis. However, it can hurt the employees' enthusiasm on labor in long term, and it will be a big problem, a big financial also, and also a big financial burden for the government. The first approach, subsidizing private sectors, and the most suitable method. It not only ensures the poor have jobs and continuous income in the pandemic, but also help the private sector's employers to maintain their operation, provide private services and products to the public normally. This avoids good shortage on market and maintains normal economic development and social peace. It is important in current situation when economy, so society and norms and disturbed by the pandemic. Whether in a short term or in long term, this method is the most beneficial one from my perspective. So I personally believe that if the prime minister could, if our government could pursue the 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 method, our poverty problem, our even more seriously poverty problem caused by the COVID-19 will be solved efficiently. So this is the end of my presentation on the poverty case by COVID-19 today. So thank you for your time, and I appreciate everyone's attention. Thing Yeah, that's it.